Welcome everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today we are reporting an increase of 5 new cases of COVID-19 in Windsor and Essex County. 1 case is outbreak related, 1 is community acquired, and 3 are still being investigated. We have had 16,795 cases since the beginning of the pandemic. 56 people are active at this time, with 12 of our active cases being a variant of concern. To date, 1,948 preliminary or confirmed variants have been identified in Windsor-Essex County. 7 people are currently in the hospital and 5 people are in ICU. Our community has lost 434 people to COVID. We are reporting 1 outbreak today in a workplace. Regarding our vaccine update, 271,047 people have received at least 1 dose of a COVID-19 vaccine. Overall, 73.9% of adults 18 years of age and older in Windsor-Essex have received at least 1 dose of a COVID-19 vaccine. 38% of our adults 18 years of age and older are fully vaccinated with 2 doses. Tomorrow, Saturday, June 26th at 8 a.m., those who received their first dose of an mRNA vaccine on or before June 2nd will be able to book their second dose of an mRNA vaccine at one of our mass vaccination clinics, pharmacies, and primary care providers. For those 18 plus who are receiving an mRNA vaccine, you must have a minimum of 28 days between your first and second dose. Youth 12 to 17 years of age are not eligible for a shortened dose and must wait 8 weeks to receive their second dose. In addition, we would like to remind our residents that with the exception of our youth 12 to 17 years of age, anyone who books a first dose or second dose of an mRNA vaccine will be guaranteed an mRNA vaccine, which could be either Moderna or Pfizer. On Monday, June 28th, the Unemployed Help Center at 6955 Cantillon Drive is hosting a COVID vaccine walk-in clinic from 8:30 to 2 p.m. Another clinic is planned for Wednesday, June 30th from 9 till 3. Youth 12 to 17 years of age will be able to book an appointment to receive their first Pfizer-BioNTech vaccine dose on Tuesday, June 29th and Wednesday, June 30th between 11 and noon at the WFCU, Libero, or Nature Fresh. So there's another opportunity for youth to be vaccinated. To book an appointment at a mass vaccination site, please visit wevax.ca or call 226-773-2200. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. Yesterday, the province announced that we will be moving to Step 2 ahead of the schedule. I truly hope that the community will take the opportunity to benefit from the additional opening of our economy, and our businesses and our residents will continue to keep the safety and well-being of everyone at the top of their mind. Please continue to follow the restrictions that will continue to exist, at least in the short term, and get your vaccine as soon as possible. I'll now start off my epi presentation. Okay, looking at the number of cases in Ontario, and we continue to see a decline in our daily number of cases in the province and moving in the right trajectory. Similarly, when we are looking at our region, we are also seeing an ongoing decline in the number of cases in our community, which is again a very good sign, something that we have last seen in August, September of last year. Putting these two slides together in terms of comparison, so overall everywhere the cases are declining, the province and the Windsor-Essex, and our effects are more pronounced than the provincial effect. Looking at our week-over-week incidence rate per 100,000 population, starting from all the way week 18 to 2020 to our current completed week, the most recent week case rate is at 12.6 cases per 100,000 population. This is slightly decreased from the last week, but if we just look at the last 7 days, our rate is now at 8.4 cases per 100,000 population. And again, this is another decrease from last week. So all the indicators are pointing in the right direction. This slide looks at our case, week-over-week case alongside with Southwestern region as well as the province of Ontario, and we are seeing a decline in all these three regions. Looking at our wastewater surveillance data, red line in the past week, our numbers have slightly increased. Hopefully this is just a minor blip and not a start of another potential trend. So again, this is a research study using the RT-qPCR method for analysis of wastewater sample and still under development. So there may be some minor variation in terms of what we actually see. So despite that, it has so far aligned very well with our case rates in the community. With this one minor blip, we hope that it's just a blip and nothing more, but something that does require some close monitoring on our end. Looking at our person positivity by week, with all the COVID-19 tests that are happening in our region. In total, more than 366,000 tests were completed as of June 19. And for the week of ending on June 19th, our person positivity continued to decline was at 1.5%, another decrease from last week when it was at 2%. Looking at our most recent 7 days person positivity and comparing it with the rest of the province, so we are well below the provincial average and pretty much right in the middle of the pack when it comes to the person positivity in the province. We are sitting at 1.6%, which is again a slight decrease from last week when it was at 2.7%. Breaking the person positivity down by different age bands, and as we can see, the person positivity is still among the different age bands is highest in the younger population compared to the older population for several reasons. As I've mentioned a few times, the younger population, they don't necessarily get the testing unless they have some symptoms. So understandably, the pre-test probability for them would be higher, and that's why we are seeing some higher person positivity in that age group. Looking at our regional and provincial case rates throughout the pandemic, we are still at number 4 with respect to the regional and provincial case rates since the beginning of this pandemic. Breaking it down with respect to the municipality, and starting from June to present, so pretty much the whole month of June, the case rate continues to be highest for the city of Windsor, followed by Essex Lakeshore, Tecumseh, and then the rest of the municipality with some variation are pretty much similar to each other. From a case distribution perspective, in the last 30 days, majority of the case coming from City of Windsor, while the rest of the municipality are more or less pretty much the same overall. In the last 7 days, what we have seen is a slight increase in the cases in the town of Essex. But again, this is just the last 7 days data, something that changes quite rapidly, especially with low cases. We expect that it will continue to go up and down, but hopefully it doesn't transform into something more significant. From an age and sex distribution perspective, we are starting to see the stabilization of all the cases in different age bands, and even in the younger population where we have a slightly lower coverage of vaccine, and 0 to 12 years of individual who are not even eligible to receive the vaccine at this time. That's why we are seeing the high person positivity among that age band, but the rest of the age bands, the person positivity, the case distribution is stabilizing in all of these age bands, clearly showing the impact and benefit of vaccination in all of these age groups. From an exposure perspective, not a lot of difference. Our case counts are decreasing every day. With very little case count, we continue to see cases coming in from the community as well as from travel and the close contacts and household contacts. From a distribution perspective, still almost 1/3 of the cases are coming from household contacts and 1/3 just coming from community spread. And another significant source of acquisition to mention is the travel related. We have seen 5% of the cases coming in from a travel related reasons, and even if it's translated into 1 case a day or 2 or 3 cases a week, it still is significant, and it highlights the importance of ensuring that people who are coming back to our region need to quarantine as per order that's given to them. From a percentage of daily VOC cases, as we always mention, the VOC cases are also stabilizing. We have seen a majority of the cases coming to our region are the Alpha variant, which was first found in UK. And we still have 2 Delta variant that have been reported to us, and we know that sometimes there's a delay in reporting the VOC cases to us. So the last few days, it may not be accurate, but it is also showing some fluctuation. And as seen in other region, the Delta variant is taking more hold and being the more dominant strain of VOC in Ontario. So we may head in that direction as well. But right now, the confirmed we only have seen 2 confirmed cases of Delta variant. From a hospitalization perspective, things are getting better in the province as well as in our region, with low hospitalization as a result of COVID. Similar picture in the ICU. Cases are declining in the ICUs in the province and in Windsor-Essex. When it comes to case doubling time, day over day comparison, everything is moving in the right direction. It's increasing. So any increase in the case doubling time, it's a positive trend, or it's getting into the right direction. We can see Canada, province, as well as Windsor-Essex County, they're all moving in the right direction with the case doubling time increasing. In Windsor-Essex, it's much more pronounced compared to the rest of the province and in Canada. The median R naught effective is 0.88. This is slightly higher from the last week where we were at 0.7. But overall, our R naught has remained consistently under 1 for the entire month of June, which again is indicating that our cases are not transmitting that much in our community, and the overall active cases are decreasing in our community. So switching gear for the COVID-19 vaccine status, looking at the picture of how many, what proportion of our people who have received at least 1 dose of COVID-19 vaccine. And Canada continues to lead the pack among some of the notable countries as identified in this graph, and are on track to vaccinate with all our residents with 2 full doses of vaccine. So we just started that giving out the second doses, and it continues to increase. And if we continue with that pace, we will definitely be one of the country with the highest vaccine coverage rate in the world. With respect to number of doses that are administered over time, looking at the month of June, we now have shifted more toward providing the second dose. All the second doses are shown in this graph in the green, and all the first doses are in the blue. So clearly we are giving out more second doses than the first dose. And just in the last 7 days, more than 90% of our doses that were given out were primarily the second dose. This looks at the same data, but what it does, it gives you also the 7-day average of the doses administered. Currently, we are administering over 5,400 doses daily to Windsor-Essex residents. And on the same day, we are also administering close to 7,000 doses a day, and that includes both the first and the second doses. So this is a new slide, and it breaks down further in terms of the overall average for the first dose and the second dose. So the line in yellow, it shows the first dose, and on an average how it's translating compared to the second doses, which we are seeing in the red line with overall progress of the 4,700 doses as second dose, whereas a little over 500 as first dose that we are giving out in the region. This looks at the cumulative number of the first and second doses administered, and overall what we are seeing is a plateauing effect in the first dose, but a sharp increase in the second dose in our region. And we hope that with the pace that we are doing, we will outpace how quickly we have done our first doses and ensure that our community is protected with full 2 doses of the vaccine. From an overall coverage perspective, we have 61.8% coverage. That includes everyone, including children as little as 1 year old or younger, and despite the fact that they're not eligible. So overall, still our coverage rate is close to 62%. If we are just focusing on the adults, our adult coverage rate is almost 74%. And then just the 12 plus is 71.5%. And we are seeing a gradient effect in all of the other age band, but recognizing that a lot of these individuals or the access to vaccine was opened up recently, and it should go up at least to 70 to 80% coverage rate in each of these age bands. So this graph also shows the impact of how quickly each of these age bands are vaccinating and where the gaps are. Obviously, we are seeing some flattening of the plateau, a plateauing effect of these vaccine uptake in all the other age band, but clearly there's a lot of room for improvement in the younger age band, especially individuals who are under the age of 50 to increase their vaccination rates. Looking at the proportion of Windsor-Essex residents that are fully vaccinated, so that those who have received full 2 doses of the vaccine. So overall, and again, this overall includes everyone, including the younger children who are either not eligible to receive the vaccine or haven't received the vaccine. That number is 29%, and just in the 18 plus. It's 36.5%, but as of today, our 18 plus coverage rate is 38%. In the 12 plus range, it's 33.5%, still showing that almost like 1/3 of our residents in Windsor-Essex, 12 plus, are fully vaccinated with 2 doses of the vaccine. So again, a significant increase from where we were before. Looking at the same data in a slightly different way in terms of where the impact is, and we can see the blue line and the green line and the yellow line, that how quickly they really picked up in terms of the coverage rate with the age bands 80 plus, and then 70 to 79, and then 60 to 69, depending on when the vaccine were opened up. So we are hoping that we will see similar uptake in other age band and fully vaccinate all of our residents in a short period of time. Focusing now only in the hotspot regions or the high priority neighborhoods with at least 1 doses of the vaccine that was administered. So as I mentioned, overall our coverage is close to 62%. Our hotspot coverage is 56.4%, and slightly lower than where our overall coverage rate, with some variation in terms of where these different neighborhoods are based on their FSA or postal codes. Looking at our coverage rate is again in the hotspot or high priority neighborhoods. With the full 2 doses of the vaccine, overall coverage is 29%, and the hotspot coverage rate is 25.4%, which is again something that we see variation even within the hotspot postal code or the high priority neighborhoods. And just to mention that there's a lot of work that's been happening, and I mentioned quite a few of them over the last Wednesday, with respect to the high priority neighborhood, and all of those efforts are led by the CMHA and supported by Public Health. There's a lot of funding that Public Health advocated to bring back to our community to support these hotspot priority neighborhoods with many initiatives, and a lot of the work has already been done in terms of the COVID response, including the vaccination effort. So vaccine access is not necessarily an issue. There's been a number of physicians, almost 1/3 of our physicians that are providing vaccines are in the hotspot neighborhood and offering these vaccines to the community. There were a number of pharmacies, 24 pharmacies that are located in the municipality of Windsor in the high priority neighborhoods are offering vaccine to our community. There were many pop-up clinics that was organized in the community, and Teresa even mentioned some of these pop-up that are already planned in this week and will continue to plan based on the needs of the community. So from an access perspective, vaccine access perspective, it's not necessarily an issue. There are other social determinants of health action that is required, which does require a lot of collaboration with many partners, including the City of Windsor and many other neighborhood groups that are working with this population. So all of that work is underway and will continue to be underway. The vaccine uptake may not necessarily be as fast and as quick as we are seeing in some of the other regions, but clearly identifying the need that there is work that is already happening and will continue to happen as we progress through this COVID pandemic in our community. So looking at where these doses are being administered is majority of the vaccines have been administered from the hospital-based clinic, which was run by Windsor Regional Hospital, and whereas in operation even before the public health clinic started in Windsor-Essex, and given out most of these vaccine, but we are seeing that the majority of the vaccine, almost 80,000 vaccines were administered by our pharmacy channel, and then almost 20,000 vaccines, or slightly over 20,000 vaccines, are administered by our primary care providers. So clearly it was an all-out community effort to increase the vaccination rates in our community. From a vaccine type of vaccine, the majority of the vaccine that was given out in our region was Pfizer-BioNTech, followed by the Moderna vaccine, and then followed by AstraZeneca. So we've got a good distribution and access to all of these vaccines, and access to all of these vaccines was again one of the key factor for us to be ahead of the curve in terms of vaccinating our community and keeping them protected. So again, now that we continue to have access to different vaccine, and we talk at length about the interchangeability of these vaccines, so it's more than important that people take this opportunity to get their full 2 doses of vaccine and be protected, save themselves and all their families. So we would like to see that momentum going and people continuing to receive the vaccine so that we can open up as much as possible. Looking at, again, by different vaccine type, and as we can see that there were some shortage issues with the Pfizer vaccine. So when we are starting to see more of the Moderna vaccine that are being used, and we talked about it, both Pfizer and Moderna, or in other words, when we call them the both mRNA vaccine, they are equally safe and protective for and effective for the prevention and for COVID-19, and both of them have provided us the necessary protection that is there for the community. And I would like to also reiterate the importance of the when people are thinking whether Pfizer is a better vaccine versus Moderna. So let me just be very clear. Moderna was the vaccine that we gave out to our community long-term care home and retirement home residents, and as a result, we haven't seen, knock on wood, we haven't seen any outbreak in these facilities. So from a safety and effectiveness perspective, you should feel comfortable in receiving either of these vaccines. They both have the same side effects profile, safety profile, effectiveness profile. So there is virtually no difference in between those 2 vaccines other than the different brands that we have for Pfizer and Moderna. So please get the first vaccine that's available to you to make sure that we continue to keep our community safe. And again, looking at our vaccination coverage rate and pulling it out all together from the and plotting it against the case rate. So as we see that our vaccination coverage rate increased, our case rate started to go down. So clearly, the cause and effect relationship that we can make some extrapolation based on what we are seeing, the importance of the vaccine. So when we had the first vaccine doses and then it started to increase in the community, our case rates started to go down. When now we are at the stage that we are giving out more of the second doses, the case rates are going down even further. So we need to be in that position where we as a community can safely open, we as a community can start to get back to normal. So please continue to get your first and second dose of vaccine if you haven't done that already. So in summary, our case rates in Windsor-Essex have decreased again and continue to move in the right direction, which is a great sign for our community. COVID-19 related hospitalization and ICU remains low, not only in Windsor-Essex, but also in the province. Our wastewater surveillance data is showing a minor blip, as I mentioned, a slight increase, and that requires further monitoring. And we truly hope that it doesn't necessarily translate into something more. So and it depends on a number of factors. It still is a research study, so we'll continue to monitor that impact. But just as a word of caution about the wastewater surveillance data. Our first dose vaccination coverage rate in overall that includes even the little children who are not even eligible. Our coverage rate is 61.9%, which is also increased compared from last week when it was 60.9%. Our second dose coverage rate is 30.2%, which is again a huge increase from where we were last week. From a monitoring indicator perspective, so most recent completed week, we are at 12.6 cases, but just in the most recent 7 days, it has dropped down further, 8.4 cases per 100,000 population. Our person positivity was 1.5% for a full completed week, but just in the last 7 days, it's 1.6%. Our effective is at 0.88. Again, it continues to be less than 1 throughout the entire month of June, which is really great. Outbreak remains low to 0, so which is again a good sign from an overall community spread perspective. Overall, our 73.9% of Windsor-Essex adults, when I say adult, that means 18 plus, have received at least 1 dose. 38% of Windsor-Essex adults, again 18 plus, are fully vaccinated, giving giving our community the edge to open up and to get back to normal. So thank you.
We'll now take questions from the media. CTV?
Hi, sorry. So just regarding, I just want to confirm again, you said effective as of 8 a.m. tomorrow, you are eligible to book your second dose if you received your first dose prior to June 2nd, correct? And if so, how is it going to be appointment-wise? Are we expecting a possible crash again? How many people are eligible in that time frame?
Okay, so yes, you are correct. Tomorrow at 8 a.m., which is June 26th, people who received their first dose of an mRNA vaccine on or before June 2nd, so that would be people who have received that dose more than 28 days ago, will be eligible to book their second dose of the mRNA vaccine. So they just go online, or they can call our call center if they need help booking that second dose. When you're asking about the amount of people, we calculated about 80,000 people would be in this category and would be due for their vaccination. We want to reiterate that students and youth 12 to 17 years of age are not eligible for this shortened dose. So they have to still wait at this time, and their period is 8 weeks. Regarding the crashing of our website, that could occur and has occurred. And we've always been able to get it up and running, but people, again, we ask for your patience, and you don't have to be right there at 8 a.m., but the eligibility is opening, and we do want people to book, and we always hope for the best, but the possibility of a crash has become a little bit of our reality.
And how much are you guys encouraging the public to go to all of these walk-in clinics? I mean, I went to my second dose on Tuesday to a walk-in clinic. It was the exact same amount of time when I went to the mass vaccination, the clinic the first time. So we do have multiple options. Sorry, I'm bringing myself up again, but I did have an initial appointment with the mass vaccination clinic. Then I went to the walk-in, and then I just ended up going online and canceling my second dose at the mass vaccination clinic. So what message do you have to the public about all of these availabilities and just trying to go out there?
Well, first of all, thank you for canceling your appointment when you received your other appointment, because that's an important piece to finish up. So thanks for doing that. That's you're being a very good role model. And yes, get your vaccine through whichever avenue you can. The pharmacies, primary care providers, the walk-in pop-ups that we are announcing today. We also are out there doing mobile clinics and have been from the beginning. So if you're in a home in an area that's being announced that the health unit is coming or the CREST team will be arriving to do vaccinations, then access that opportunity. So what you did is exactly what we want people to do, is get vaccinated first and second doses when you're eligible, when you're able, and just see it through and spread the news and help others get vaccinated too.
Okay, and we just received a release from the province, and I'm sorry that you mentioned this. I just have a hard time hearing you, Teresa, because it's kind of cutting out a bit. They announced that as of June 28th, everyone who received their second dose, 18 and older, will be eligible for their second dose. Is that happening here in Windsor-Essex as well?
Yes, so that is exactly what our announcement is. However, the ministry's opening up is saying that anyone as of June 8th, well, they're saying on Monday, but we're doing on Saturday. So what we're announcing for opening up tomorrow is what is happening with the province on Monday, on June 28th. We've just had a little bit better experience opening it up on a Saturday because we have people at the call center able to help people book. What is different from the province is that they've opened up everything. So we have kind of made it to June 2nd, I believe I said, because of we know that 80,000 people are due, and they will be within that, they will have passed that 28-day mark, or the timelines work out. So the province has opened it up on their provincial booking system. We have opened it up to June 2nd and tomorrow, and we'll be opening up wide as other eligibility dates become available. But the province has just done that final release, so that's perfect.
Okay, sorry, I'm just going to say this one more time because you are cutting out. So right now, June 28th that the province has announced it doesn't affect Windsor-Essex at all. The only date that we have moving forward is June 2nd, and then moving forward, you guys will make the next announcement for whenever you feel is appropriate for everyone 18 and older.
Yes.
Who received their first dose.
Yes, so tomorrow, June 26th,
okay.
Everyone will be able to book their second dose that are eligible. The only caveat is that you would have had to receive your first dose by June 2nd to be eligible for a second dose starting tomorrow. Is that clear?
Thank you. Thank you.
Okay.
Yep.
CFTV?
No question.
Blackburn?
Yes, good morning. So it's only been a couple of days since you made the announcement about Moderna being a primary vaccine at the mass vaccination clinics. Have you had any issues with people turning away the Moderna and wishing to wait for a Pfizer?
So I can start. We initially, there are people that have, turned away. I don't know exactly how much, but we've actually changed our strategy a bit. We are asking that people just to come to the clinic, and whatever vaccine is there, once they sit down with the vaccinator, one of our nurses, they'll be able to ask any questions they want. We don't want people just saying, oh, that they're giving Moderna and leave. We want them to have that conversation with the nurse and express whatever concerns they have. We know they're essentially the same vaccine. So please, just go to your vaccine appointment. No matter what vaccine is being given, the nurse will be able to answer any of your questions and proceed with the vaccination. Or if the person needs more time to think about it, then at that point they're free to to leave. But we are asking people to attend their appointments and get the vaccine, no matter which one it is. So in answer to your question, we do know that happened on the first couple of days. We're seeing less and less of that because we are asking people to have that conversation with the nurse.
Thank you.
Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. We can see from the WeVax booking portal that demand is still very, very high for second doses. how is uptake at primary care provider offices and pharmacies?
So the primary care providers are, they're doing very well. So as you are probably aware that they have their own client base. So anytime we release an opening or extend the eligibility, they're right there with us and they're getting all of their clients on board. So uptake is good there, and pharmacies as well. The pharmacies are, I think we have 79 right now, but we may have more getting onboarded. But that is the provincial plan. That was our plan as well, that pharmacies and primary care providers really become the main way for people to get vaccines as we start, looking at the mass vaccination sites and how long we're able to keep them open. So in Windsor-Essex County, I think because we engaged our primary care providers early and had conversations with the pharmacies and supported them, we have very good channels through those outlets.
Thank you.
AM 800.
Good morning. I'm just wondering, sort of going back a little bit to what Maureen was asking about people turning down the Moderna shots. I know you mentioned that you are working to educate people in hopes that they will maybe change their mind while they're sitting there, but there have also been calls for there to be some type of notification when people are booking the appointment that they are told whether it's going to be Moderna or Pfizer at the time of booking. Is that something that is possible?
It's possible, but I can be honest, it's not likely. Our vaccine supply, we are supplying vaccine to primary care, to the mass vaccination clinics, and to all of the sites. And so we are managing that every morning with whatever vaccine we have in-house. And so it's, it's not really, something that we can really guarantee to do anything like that anymore. We know that as our vaccine supply changes, we're giving that allotment for mass vaccination clinics for that day. And when you're talking about 500 people getting vaccinated at a clinic in the municipalities or 1,000 in Windsor, that's a lot. So in some of these clinics, they're starting off with one vaccine and going to the other one. We truly are interchanging these vaccines based on our supply. We know that we have both right now, Pfizer, we have Moderna, and we know that Moderna will be probably the primary one moving forward. We want people to really be comfortable that it could be either or, and you're getting an mRNA vaccine. That's what our clinics have. And that's what we're guaranteeing. So you won't have the ability to really know. And we are, we use what we have in-house.
I just wonder also, yesterday Windsor Regional Hospital reported to us that out of nearly 4,000 appointments between the Sportsplex and Devonshire Mall, that 123 people turned away the Moderna once they got there and they left. So that's a quick turnaround. Are those appointments able to be filled that quickly from the mass vaccination sites once someone cancels on the spot, or are we having vaccines spoiled because of that?
So I wouldn't say we have any vaccines spoiled, and we have conversations with Windsor Regional Hospital 3 times a week because we all experience the same kind of issues and we want to be consistent. And so what, there's storage and handling requirements for the vaccine, so that is well monitored throughout the day. And we at one point we had these wait lists and called in people, so we do have wait lists and they can be called. But overall, the management of the vaccine is kind of like it's being monitored throughout the whole day to avoid any wastage. People are able to they're able to attend, and if they do walk away in those 123 doses, because our vaccine supply has been a little bit, as you know, earlier on in the week, we were waiting for our shipment to come. So we weren't really worried about people that did not show up for their appointment or had, changed their mind, because we were wanting to kind of preserve some of the vaccine, knowing that we were waiting for shipments. So I think this week we weren't totally, upset with people not using their appointment based on the situation with the vaccine shipment. But now that it's all here, we'll continue to monitor and, fill every spot as best we can.
Thank you.
Radio Canada.
Good morning. Some employees of the casino, along with some local politicians, are lobbying for an earlier reopening of the casino. So it's normally supposed to reopen in step 3, but they would like to see it open during step 2. What do you think?
So I can't really answer that question because it is a truly a provincial regulation, and as much as I can see what's happening in my community and how our case rates in our community is moving along, so we are in a good spot. But any of these changes, if needs to happen, it will come from the province, and I'm sure that they are looking into it.
Okay, thank you.
So before I move on to the second round of question, and I just want to take this moment to acknowledge, because again, I would be remiss if I don't mention that, because I did talk about it a couple of weeks ago about tolerance, about kindness, and it was unfortunately, hearing some of the news that we heard yesterday about another mass grave that was found in Saskatchewan, and it is a sad day for all of us, for Canada, to see the loss of lives and finding of these graves, which continues to be a problem. And moving forward, obviously we cannot correct what happened in the history, but moving forward, I think it is important that we learn from these moments, and we learn how hatred and how some of these ill actions, prejudice, xenophobia, all of these things can have an impact in the community. So I just want to make sure that I continue to reiterate the same message of kindness and tolerance about everyone, and how we as a society can move forward. So just wanted to take that moment to acknowledge and this sad moment in our history, and want everyone to be aware of what is happening.
Any additional questions from CTV?
No, thank you.
CFTV?
No, thank you.
Blackburn?
No, thanks, but I am off next week, so again, I just wanted to say congratulations to Teresa and enjoy your retirement.
Thanks very much. I appreciate that.
Windsor Star?
No, thank you.
AM 800?
No, thank you.
And Radio Canada?
No, thank you. Congratulations once again to Teresa.
Thank you.